Alrighty. What's going on, everybody? What is today? Happy Wednesday. We're going to be going over a lot of your health questions. So the other day I posted a video or posted a comment and asked, what do you guys want to know more about? What health topics do you want us to dive into? And the goal here is we really just want to see we want to be able to create a group where we can answer questions, where we can kind of understand what's going on with some of these health challenges. So we got a lot of really great questions, and we're going to kind of dive into those today. So what I want you to do is, if you are on this live and you have specific health questions, I will answer those. I'll try to get to them. I've got about 25 minutes here before I got to jump out with some patients. So I'm going to start with the questions that were posted earlier this week. If you have other health questions, go ahead and jump on and comment those, and we'll make sure to get to those here. If I don't get to them this time, we'll make another video next week. The goal is we're going to start going live to be able to answer a lot of these questions at least once a week. So we'll get to them on the next video, and they'll be top priority. So again, drop those questions below. So first question came about sugar and diabetes. So I've got a couple other videos. If you don't follow my YouTube channel yet, Dr. Connor Wolf, go ahead and jump over to YouTube. We'll drop a link to that YouTube channel here in the comments below. Give me just a second. I'm going to do that right now so I don't forget. So just dropped that YouTube comment or that YouTube channel there in the comments below. Go ahead and watch a couple of those videos on diabetes, the perfect diet, things like that. So we're really understanding sugar regulation. So this question was more about what can I do myself to help support the sugar regulation in the body. And this was from somebody who's been doing the no sugar challenge. So first things first, if you want to help with blood sugar regulation, we've got to just stop eating sugar, right? It sounds so simple, but we can't be fixing a problem if we're constantly doing things that are feeding into that problem. So we've got to get rid of the sugar. One of the best ways to start getting rid of the sugar is with the no sugar challenge diet. So the no sugar challenge, we all did that together back in January. If you got questions about that, reach out to one of us and we can get you all the information for that. But that's first and foremost, we got to get the sugar out of the diet. And then once we've removed the sugar from the diet, we'll talk about some lifestyle things. So sugar regulation, diabetes is an issue because what happens is our blood sugar increases and then it decreases, right? So every time we eat a meal, we bring sugar into the body. Every time the blood sugar increases, our body's going to produce a hormone called insulin. That hormone is produced in the pancreas. Insulin then binds to the cells. It opens up the little door so the cells can then bring that sugar into the system and they can utilize that sugar. So what happens is with diabetes is we get what's called insulin resistance. And insulin resistance basically happens because we spike our blood sugar and then we spike our insulin. And every time we spike our insulin, our cells become a little bit more resistant to it. So we want to do things that are avoiding that insulin spike. So that's where cutting all the sugar out of the diet. If we're not eating a ton of sugar all the time, we're not going to be creating those insulin spikes. So that's number one. Number two is if we are having carbohydrates, let's bind them with proteins and fats to kind of blunt that insulin response a little bit. That's going to delay that blood sugar spike. So instead of looking like this, that sugar spike is going to look more like this. So that's first off. And then talk about some things that we can do to help your body regulate sugar. So one of the biggest ones is exercise. Now, our body's always going to hold blood sugar kind of in this homeostatic window. And so what will happen is if our blood sugar increases, one of two things can happen to drop that blood sugar back down. We can either create insulin through the pancreas. Insulin is then going to, again, go to the cell, pull that insulin or that blood sugar into the cell. We're going to utilize it for energy. If we don't have to utilize it for energy, then we're going to store it as fat. So that's one of the big reasons we're gaining weight, we're dealing with insulin resistance, we're dealing with diabetes, things like that, is because we're not utilizing the sugar that we're taking in for energy purposes. So ideally, what's going to happen is we're going to intake our carbohydrates around exercise. And what happens is when we exercise, the skeletal muscles, we're going to be moving those muscles around. They're going to be actually sucking in all that sugar for energy. And so muscles can actually work independent of insulin. So even if you have insulin resistance, if we're exercising and strength training, we're going to be just gobbling up all that blood sugar. And that's going to be one way that you can manipulate your blood sugar without medications, without insulin, things like that. So Biggest things with diabetes is number one, we've got to change the diet. If the diet doesn't change, nothing else is going to matter. The other one is strength training and exercise. So increasing lean muscle mass is going to be very important. One of the other ones that we can kind of tie in a little bit to blood sugar regulation is actually utilizing the cold plunge. And the reason for that is in one of my talks I did, it's posted on, again, my YouTube channel. It's called The Perfect Diet. At the end of that talk, I talk a little bit about cold plunging. And before that, we talk about kind of the 4 different ways that we burn calories throughout the day. So we've got our basal metabolic rate. This accounts for most of the calories that we burn under normal circumstances. This is all the energy it takes for us to just exist, right? So breathing, your basic metabolic functions, heart pumping, lungs breathing, all that stuff. Then we've got NEAT, which is non-exercise activity thermogenesis. This is everything between existing and exercise. So this is me sitting here having a conversation. It's you waking up and making breakfast, a cup of coffee, that type of stuff. We've got exercise, which accounts for a very small portion of our calorie expenditure typically. And then we've got the thermic effect of food, which is how much energy it takes to actually break down the food that you're eating. So one thing that we can do to actually increase our basal metabolic rate, number one, increasing skeletal muscle tissue will help increase that basal metabolic rate. We'll be utilizing more sugar throughout the day. The other thing is cold plunging. Reason for that is because cold plunging is going to increase our brown fat production. Brown fat is then going to increase thermogenesis, so we're going to be burning more calories at rest, essentially. And that can also help to regulate blood sugar. So outside of supplements, which I don't want to dive super far into supplements just because I don't want people going out and grabbing a bunch of supplements without first looking at blood work. Big things is going to be exercise, increasing that activity level, and then things like cold plunging to help increase brown fat production, thermogenesis, things like that. So hopefully that helps with some of the diabetes stuff. Next question we want to jump into here is statins. So please talk about statins. I have a family member on them and have read real bad things. Yep. So statins is one of the biggest kind of hot button topics. It's a barbed wire issue. You've got people on both sides of the fences that go crazy about it. So let's just talk first about what the research says. So the research only points to risk reduction from cardiovascular events in a certain very small population. So that population is going to be middle-aged males that have already had some sort of cardiovascular event, meaning a heart attack or a stroke. Statins do not have any risk reduction for primary prevention, meaning that me, for instance, I've never had a cardiovascular event. Taking a statin medication, there's no research that shows that it's going to prevent my risk of having a cardiovascular event. The research that shows change in life expectancy, taking statin medications adds about 4 days onto your life expectancy if you're in the primary prevention category. So where statins have all of their utility is in the secondary prevention category. So again, middle-aged men who've already had cardiovascular condition. Now, the issue with the statin medications is they're demonizing cholesterol. So they're saying that because plaquing in your arteries is made of cholesterol, cholesterol must be the problem. And the problem with that argument is that cholesterol, yes, it makes up the plaque, but cholesterol is not what caused the problem. Cholesterol responds to your body to heal. It's part of the tissue healing process. So if something damages your arterial walls, we're going to get a cholesterol response. That's, again, part of that natural healing process. So if you're following me on this, if we have to have cholesterol in order to heal, what's one thing that we're going to see if we start to artificially reduce that cholesterol through medications like statins? Well, we're going to limit our body's ability to heal, and that's not going to be a good sign. So that's going to create a lot of the side effects that we see coming from a reduced ability of your body to heal the way it's supposed to. So saying that cholesterol caused the problem in the arteries is kind of like saying that police cause crime. Well, police don't cause crime, but they're at the scene of every crime. Well, what's going on? The crime was committed, and then the police responded to the crime. Just like something damaged your arterial walls, and now the cholesterol is responding to help clean up the damage. The problem is that when we have a specific type of cholesterol particle called a small dense LDL particle, or SDLDL particle, those are going to be very small sticky particles, and that's a specific type of LDL. So when we look at our total cholesterol, our total LDL, our total HDL cholesterol on blood work, all that's measuring is the weight of cholesterol. So it's basically like saying, I'm going to tell you how much traffic is on the highway by giving you the total weight of all the vehicles that are driving down the highway. And when you put it like that, it's easy to understand that we don't really know anything about the traffic level just based on the weight of the vehicles. Because if I say we have 100,000 pounds worth of vehicles on the highway, was that one semi truck on a 3-lane highway that weighs 100,000 pounds, or is it 100,000 pound cars? And obviously 100,000 pound cars is going to cause way more congestion on the highway than a single 1,000-pound semi truck. So that's where we got to kind of put this into perspective. So with our cholesterol molecules, if we have a bunch of really small dense particles that are making up that total weight, it's going to be much more damaging to the body than if we have a bunch of large buoyant molecules, like fluffy cloud-like molecules, right? So when we look at this in blood work, we can see the small dense LDL particles. If those are high, we know there's a risk for cardiovascular disease. And I've seen people with low and normal LDL levels and high small dense LDL particles. And I've seen people with really high LDL particles but very low small dense LDL particles. The other way to think about this is think about a tennis net. A tennis net is designed to stop tennis balls. So if I hit 200 tennis balls at a tennis net, not going to be a big deal. They're not going to get through, right? But if I hit 50 golf balls at the tennis net, it's going to be a much worse day, right? So even though we hit 200 tennis balls, it caused less damage than 50 golf balls. So what happens is something damages the arterial wall. We've got 3 different layers in an artery. And then what happens, we kind of have a cholesterol response coming in to heal that damage. And we have a bunch of small, dense particles that can get under that inner layer. And then they start to create what are called foam cells. They start to create that plaquing response, and that's what creates all those issues, right? So if we know and we can look in blood work and say, okay, even though your total cholesterol is high, we know that the really dangerous particles are low. We know that we're at a low risk for cardiovascular disease. The other thing we have to look at is what are some of the things that cause the particle size to shift towards that small, dense particle size? Well, that's going to be things like oxidation, things like inflammation, things like sugar. All of those are going to change the shape and size of those cholesterol particles towards a more damaging particle size. So if we want to avoid cardiovascular risk, what do we have to do? Avoid oxidation within the body, which is increasing antioxidants. Avoid inflammation, so avoiding inflammatory triggers or taking anti-inflammatory supplements, turmeric, boswellia, things like that. And then we've got to avoid sugar. So back to that diabetes thing, we've got to avoid that sugar, right? So all 3 of those things are going to help prevent cardiovascular disease. If we run a blood panel and we see that you have really high levels of small dense LDL, if we see that you have high levels of homocysteine, high levels of lipoprotein a, there's a lot of other things that we can do. But just looking at your total cholesterol, your HDL and your LDL cholesterol is not going to really give you any indicator of cardiovascular risk. If you want to take that 4-marker lipid panel that your medical doctors run, the biggest thing that you can look at for risk factor is, number 1, is your HDL above 50. If your HDL is below 50, that's going to indicate a much higher level of risk. And the other one is looking at your HDL to triglyceride ratio. So if your triglycerides are more than double your HDL molecule, that again is going to indicate a bigger risk factor. But just your total cholesterol and your HDL or your LDL cholesterol alone are not going to kind of convey any sort of risk there. All right. So again, guys, if you have questions throughout this, go ahead and jump on, leave comments, and we will get to those questions either today or in the next video. Next one is allergies. So how do they come about? Prevention, natural relief, help. My son is experiencing allergies all of a sudden and no clue where to or who to turn to. So we can definitely help with allergies as well. So allergies, I'm not sure if this was specifically talking about food allergies or if it was talking about environmental allergies. But this is a question that we get all the time, is environmental allergies, especially as we start to move into springtime, as things start to come into bloom. You start to get that congestion, the runny nose, the vision issues. My allergies in the past have been so bad that I feel like I'm just staring through like the Claritin commercial where they've got that foggy window where you literally can't see. So first year I moved to Florida was terrible. I thought I needed a new prescription. My eyes were so bad. And it was all allergies related, not actually vision related. So it was very frustrating. And the most frustrating thing about seasonal allergies is you can't get away from them. So when we look at the allergic response, we look at kind of, is our immune system skewed more towards an inflammatory, pro-inflammatory state, or is it skewed towards an anti-inflammatory state? If we're doing a lot of things that are inflaming and triggering that immune system, we're going to end up skewing more towards a hyperactive immune state. that's going to be more of a pro-allergic state. So we could dive all into the kind of physiology, the immune function, Th1, Th2 responses. For the sake of this argument, we don't need to get into that. If you guys want to see another video where we talk all about the immune response to allergens, I can definitely do that. Just drop a comment below. Let me know you want to learn more about allergies. We can talk about the specific immune responses that take place with T cells and everything in that immune response to allergies. But for the sake of this argument, let's just use an example of a sunburn. So if I rub my arm like this, it feels totally fine. No issues, no pain. I'm just rubbing my arm, right? What happens if I go out and I spend all day in the Florida sun and I get roasted and I get a very bad sunburn? The exact same amount of stimulation is going to be excruciating because something has already inflamed and irritated my skin. So that's kind of what I say when we're skewing our body towards a pro-inflammatory state. It's going to be more sensitive and more susceptible to some of those allergens and things like that. So what can we do to stop this? Well, if we know that we can't control the environment outside of moving, outside of walking around with some sort of HEPA mask or something on, that's going to be there. So let's think about what we can control that are going to be triggering an immune response, that are going to be creating inflammation in the body. And foods is a really big one. So one of the biggest things we do with people with seasonal allergies, people with snoring issues, people with like on CPAP breathing machines at night, is we have to look at food allergies actually, because if we're constantly eating foods that are also triggering the same part of the immune system that responds to seasonal allergies, it's going to sensitize that system. And that's basically like giving yourself a sunburn every single day and then wondering why it hurts to touch your arm. So if you're dealing with seasonal allergies, one of the best things that you can do is get IgG food allergies tested. And so these are the delayed responses. It makes up about 70% of our immune system, that type of response does. It's not the immediate anaphylactic response. This is something else we can do another video on in the future if you have more questions about it. But reach out to one of the Wellness Right doctors here in this group, and we'd be more than happy to explain and kind of talk about what that food allergy test looks like. But for almost all of our allergy patients, that's going to be one of the biggest things. And the awesome thing about that is when you get those test results back and you start avoiding those food allergies, allergy symptoms clear up very, very quickly. Now, let's talk about from an allergy standpoint what's happening physiologically in the body. And that inflammatory response to an allergen, like a seasonal allergy, is going to be a histamine response. So when it comes to actually helping support the allergies, there's a couple different supplements and herbs that we can use to help actually calm down that allergic reaction. First one would be nettle. Nettle's awesome. Nettle's going to help you break down histamine and stop the production of histamine. And then once we've broken it down and stopped the production, we have to clear it out. So we have to start actually supporting the liver's ability to remove histamine from the body. So things like turmeric, schisandra, milk thistle, dandelion root all can help to speed up that liver detoxification. So if you're dealing with allergies, if you just want some immediate relief, nettle is an awesome herb. You combine it with something like schisandra and milk thistle, you're going to do wonders for those allergy symptoms pretty quickly. Milk thistle is one that don't take milk thistle unless you've had blood work done and talked to one of the docs, because milk thistle can actually push your liver too hard and create deficiencies. So just make sure you're being careful with milk thistle. But almost everybody can take nettle and schisandra, and that'll help with a lot of those allergy symptoms. All right, last one. I believe here is on osteoporosis. So this is a question that we get all the time. And I don't think it's anything specific about osteoporosis, just wanting to learn more. And so osteoporosis affects mostly females, mostly middle-aged females as they go through menopause. One of the biggest reasons that osteoporosis is tied to menopause is because as you go through menopause, there's a decrease in your estrogen levels. A lot of women get really bad hot flashes and things like that as they go through menopause. That's another really big sign that your estrogen levels are depleting. And we'll talk about why estrogen levels deplete as you go through menopause in just a second. But one of the biggest reasons that this relates to osteoporosis is because our bones are constantly either being built up, mineralizing, or they're being broken down or demineralizing. And so there's two different cell types we've got osteoblasts and osteoclasts. So osteoblasts are going to build your bone, osteoclasts are going to break it down. And estrogen is really important from a metabolic standpoint at increasing osteoblast activity. And so if we're having our estrogen levels decrease as we go through menopause, it's going to slow down that osteoblast activity, and then we're going to start skewing more towards bone breakdown as opposed to bone repair. So working on your hormones is going to be one of the biggest things. If you're going through menopause, if you haven't had your hormones checked, definitely reach out. That's a big thing that we want to focus on. But what can we do? Why do hormones decrease as you go through menopause in the first place? And the short answer is stress. When you're cycling, your ovaries are going to be the biggest producers of estrogens. As you go through menopause, that production shifts to your adrenal glands. And your adrenal glands are also your stress hormone producing glands. So if your adrenal glands, which sit right back here on top of the kidneys, have been busy producing stress hormones your whole life, they end up getting depleted, and this is kind of what we call adrenal fatigue. So if you get into that adrenal fatigue, now we have to also rely on those glands not only to produce stress hormones, but to produce your estrogen or your female hormones. We're going to be depleted, and that's why we a lot of times can't keep up with the need for hormone production. One of the other things that we'll start to see with this is that women will start to gain weight as they go through menopause. Biggest reason there is that if you can't keep up with the need for hormone production from your adrenal glands, you're going to start shifting into fat production, because fat can also produce estrogen, and then you'll never be able to lose any of that weight until you can create sufficiency within the hormone. So a lot of women run and get put on estrogen creams and pellets and things like that, which is fine in the short term because it makes you feel better, but we don't want to do that as a long-term strategy, just because we can have conversion issues that can end up leading to bigger issues like cancers and things like that. So we always want to try to figure out what can we do from a natural standpoint to support your body's ability to produce hormones in the first place. And so that's really where getting your hormones checked is going to be of huge benefit to you. So if you're dealing with osteoporosis, if you're a middle-aged female and you've already gone through menopause, or you think you're shifting towards menopause, chances are that estrogen is going to be a huge player in that. Now, outside of estrogen and hormonal regulation, what are some other things that we can do to help support bone growth? Well, one of the biggest things with bone growth is that bone growth is stimulated by what's called the periosteum, which is a one-cell layer thick, basically covering around your bone. And there's a lot of nerve endings that kind of innervate into that periosteum, and they control bone deposition. So we talk about strength training being very important at maintaining bone deposition, because as the muscles and tendons pull on the bones, that pulls on the periosteum, it then stimulates more bone production. It's called Wolff's Law. The body will lay down more bone in areas of increased stress. So we get things like bone spurs that form because we're constantly pulling on tendons and ligaments that insert into the end plates of the bones, and that causes an increased laydown in bone. So if we want to use that to our advantage, what can we do to put stress on the bones? Strength training is very, very important. The other nice thing about having an increase in muscle mass is if you were to fall or get hit or something, you're going to have more protection. The less muscle you have, the less protection you have over your bones, the easier it's going to be to injure or damage them. So if you have osteoporosis, increasing muscle mass is kind of a twofold thing that's going to be really, really supportive for you. The other thing that you can do outside of muscle mass is actually stand on the vibe plate. Now, the vibe plate that technology was created by NASA to use in space on astronauts because they kept losing bone mass. So we talked about it's the stress on the bones that causes the bones to lay down more bone. And so when you lose gravity, you lose all the gravitational forces on the bones, on the muscles, things like that. So astronauts were coming back from space with almost no bone mass, simulating the same thing as basically osteoporosis. And so they got these vibration plates, and the vibration stimulates that periosteum in the same way that pulling on it from a muscle would. So that's a really cool way. It's something you can put in your home. If you do have osteoporosis, stand on that thing 20 to 30 minutes a day. That will help to increase that bone density in the same way that strength training would. Now, we still want to strength train. We still want to work on balance. We still want to limit our potential for falls and things like that, just because falling in the elderly population is one of the biggest kind of factors for longevity. So we want to do everything we can to prevent that from happening. But if you're dealing with osteoporosis, get your hormones checked. Make sure your hormonal levels are where they need to be. And after that, let's increase strength training, weight training, things like that, and stand on the vibe plate. Getting adjusted can be very helpful as well. So I think that wraps up the 4 questions that I had from the other day. It doesn't look like anybody jumped on to post yet. But again, if you're watching this as a rerun, throw up a little hand. Let us know you watched it. We'd love your feedback. I want to be able to help support everybody in their own individual health journey as much as possible. So if you guys have more health questions, go ahead and drop them in the comments. I'll be back on here live again next week to answer any questions that come up in the meantime. And until then, I hope you guys have an awesome rest of your day and rest of your week. Take care.